Hello, I'm Gerald Finken, and I'm CEO of RxE2. We're bringing the practice of pharmacy to clinical research, and every day we're making progress. One of the things I want to talk to you about is this revolutionary, innovative, disruptive way that we can do clinical supplies that I'm going to talk a little about time, cost, quality, that I call E2 Dispensing, for everyone, everywhere dispensing. And I think this is an extremely important topic that I've spent years trying to understand. And for me, it's so crystal clear about why the time, cost, quality issues are finally going to be addressed with clinical supplies. But I have a feeling that by the time we're done with this session, you're going to go like scratching your head going, what is he talking about? But we'll address it at the very end. So let's jump into this. And I want to point out that I'm not going to answer all your questions, and I'm going to hit on the high-level things that I think are most important. Just you start asking yourself questions about, like, wait a minute, like, why do we do it that way? So let's get started, okay? Ta-da! Drug, GMP labeling, because we're talking about labeling, right? GMP labeling, of course, good manufacturing practices. But you know, when you take a look at the GMP labeling requirements, do you know what section that falls under? 21 CFR 201. There's a whole list of guidance requirements there for the labeling of GMP material. One of the key things I always found very interesting was the caution statement that was required. It says federal law prohibits dispensing without a prescription. We all know what that is, right? That's commercial drug, right? And of course, in 1997, they changed this. They didn't need that caution. You could go to Rx only as another way to represent that. They need a prescription to dispense this drug. We all understand that. We all know that. These regulations have been in existence for a long time. But please note that all of this is prior to dispensing. GMP labeling all prior to dispensing at a pharmacy. And I want to note, too, that 210, 211 equals a GMP, right? Where everybody knows that that's GMP. But if you look at that, that doesn't talk about the labeling requirements. That talks how to, and we'll get into that. The next thing I want to point out is when we talk about clinical supply labels, is really everyone knows 312.6. And that statement's there, you know, no misleading information. But more importantly, we all know the caution, new drug limited by federal, U.S. law to investigational use. We all know that. And so for GCP labeling, it's the only requirement. So think about that for a minute. It's like, it's the only requirement. So if you put that on a GCP label or our good manufactured, you know, produced material, that's good to go for clinical. I think we'd all have a little bit of question about that. So does this look familiar, this caution statement? Kind of looks familiar to the commercial side, doesn't it, about the caution statement? So maybe this statement was meant that with all the other labeling requirements for GMP material, that this was the caution statement, right, of how we should label, knowing that it's investigational drug. The question, like I said, is that statement all that's required? Well, we know that that's not what we do. So let's talk about GCP labeling, right? Because that's really what we're talking about. So we know how to produce under GMP, but let's talk about GCP labeling. What is included on bulk drug shipments in GCP labeling versus what is included to site drug shipments? So you have GMP material, and when you send it to another GMP facility or to a contractor to do more work, how do you label that? Versus under the same guidance of which have been working forever under GMP facilities, we have a different set of labeling requirements we use, you know, of what's included on a label going to a site. So why is that? Well, I put a little asterisk there to remember this and to ask you about that labeling requirement. So I have the question is that too prior to dispensing? I believe so. And that's a critical separation about where E2 dispensing goes and why it's going to be better with time, cost, and quality. So So let's jump into GMP manufacturing labels. So you have to manufacture the labels. And we know how the GMP works, right? So you create a GMP label proof because you have to get it reviewed and approved before you then print thousands of labels, right? Then we're going to manufacture those labels. And if you ever looked at the requirements for the labeling of these, producing of those labels, gang printing of labels, that was one of those topics that forever, like gang printing of labels. What does that mean in the clinical supply world? When would we ever use that? And that was just one of those things that got me thinking when I created my on-demand about how we label clinical supplies and why. And now with my E2 dispensing, I know why that doesn't exist in our world. The other thing then, of course, once the labels are produced, we release those labels, right? They all got to go through quality assurance and quality control checks to make sure they're all printed correctly, because then they're going to be used later on. So of course, then we store and control those labels. Now, it could be those labels are printed and pretty quickly go to the production lines, right, for use. We know that. So let's jump over and take a look at this. So now we have the labels produced. What do we do with them? Well, we go to the GMP labeling of bulk drug. You take those labels and let's do something with them, right? And how do you do that? Well, we create a master batch record. Interesting, a master batch record before you actually create a batch record, because that's what the GMP requirements say. Then you say, okay, let's schedule the resources. So this is instructions about how to package a label. Then we schedule the rooms and all the resources and people we need. We then receive the GMP bulk material, receive the GMP bulk drug, because we need drug. And then, of course, we receive the GMP produced labels, drug and labels, and of course, containers and other things. Like I said, we're going to be kind of high level on this, so please bear with me. I'm not going to include everything. We'd be here a week. So anyhow, we have these two things in room. We have the resources, we have the labels, we have the drug. Let's go to work. We package the label according to how the instructions of the batch record said. Good to go. It's all done. We close out the rooms, we send it over, the batch records to quality control, quality assurance, and they release the package and labeling of that bulk drug. Good to go. Let's put it, store it, and ship it. We can store it or ship bulk drug. And again, ship bulk drug. We'll talk about that in a second. I knew I had that asterisk up there for a reason. Were you questioning what that was going to be? I was. So the question is, where do you ship your GMP bulk drug? 99% of all bulk drug gets shipped where? The pharmacies, through warehouses. In clinical supplies, clinical trials, we ship it to the clinical site. Well, let's change that. Why can't we? Let's not ship it to the clinical site. Let's ship bulk drug to a pharmacy. So let's think about that if we do that. What would be required under GMP now if we send GMP material to a pharmacy, just like we do in commercial? I'll let you think about that. Let's compare. Let's compare to pharmacy labeling of bulk drug. How does that work? Well, you receive bulk drug in a pharmacy. They always get bulk drugs. They store it on the shelves, right? You receive a prescription, kind of like batch records. You create and print the prescriptions. Same thing as you need a label and you need the drug, need a container. So we create and print these, and then of course we put it all together, just like you do in a batch record, except this is a little bit faster. And then of course, the big thing is we release it. Every one of these gets QA reviewed and approved because that's the pharmacist. By law, they're the QA to release that prescription to then dispense or store, just like GMP material. Look familiar? Pretty much identical steps, just in a different setting. And of course, a little bit different regulatory requirements. No asterisks on this page. So addressing, as I said in the very beginning, I wanted to review what we have and then really go into this time, cost, quality aspects, because that's what gets me really excited when you work this through. And if you agree or disagree, we can talk about that. But anyhow, when you think about the GMP side of things, the time to dispense, the time it takes to get that first drug to the patient is probably 1 to 6 months or more, right? And you maybe less, but that would be like, well, we can talk, well, forget it. We don't kill ourselves trying to do that with the other projects we have going on. How long does it take in a pharmacy to do that? 2 minutes. 2 minutes to dispense, 2 minutes to dispense, 2 minutes to dispense, 2 minutes. Now you're going to say, oh, that's so different. Think about it. think about what does it need to the patient, right? What are we dispensing? 1 unit. Now, it takes 6 months to get thousands of units, but you still then have to dispense each one at a time. 2 minutes for each one. The cost of the label. Now, we know in the GMP side of things, in a production commercial world, the label might be 2-3 cents a piece. But in the clinical supply area, we know the labels are $1 to $25 with booklet labels, etc. What's the cost of a label in a pharmacy? Probably about 1 penny, no matter how you use that label, whether it's in Spanish, whether it's in Ukrainian, or whether it's in English. It's about 1 penny for that label. So, like I said, this is very oversimplified, but I simplify it again to drive home some points. We could talk about many of the other time and cost, because for instance, on this side, how long does it take to prepare to get ready for here? Hours. How long does it get ready for here? Months and months. So from a project management point of view, give me this any day. And I think you'll agree as we talk about it. So speaking of which, let's talk quality. Let's talk patient-centric. Let's talk patient-friendly. Everybody's talking about this. Let's do something about it. Let's improve the quality of our clinical labels. So under GMP label, we have protocol number, randomization number, sometimes visit number, sometimes site number. And of course, we have the directions used as directed, especially if we have to do the various inventory methods that we use to be able to use that drug across protocols. And these are just a few of the things that we all know what goes on the label that we prepare for the sites to dispense. Let's go over to the pharmacy though. Patient name. That's a pretty user-friendly thing, don't you think? How about prescription number? Do you know what a prescription number is? I don't think there's no one in the world that doesn't know what a prescription number is. How about detailed directions just for you? Gerald, take this drug 3 times a day and don't take it with your pravastatin. Okay, I get that. An expiry date. What a wonderful thing. I have it on my shelf, and guess what? I know one. I can't use it anymore. Do we ever put expiry dates in the US on our GMP label? I don't think so. Number of refills. Wouldn't it be nice to say, listen, you have 6 refills. I think I can equate that to 6 visits. Do we have refills over here? No, we have a visit number. And are there more visits? Well, maybe if we remember there's more visits. So I know these are just a few things that I look at and I say, oh, please let me do this. Please let's use this. And why not as we get to decentralized clinical trials, which is really driving this. Because now we're taking from a GMP facility and going direct to the patient, and you have to go through a pharmacy. You have to go through a pharmacy. So this is going to come no matter what we're doing. Most importantly, because this just makes sense. If we want to be patient-centric and patient-friendly and better quality, let's move to the next level and save time and money while doing it. So then I have another question. Ready? What do you think it says? Which label would you prefer? I told him my opinion. Think about it. Which one would you prefer? So last but not least, I created On Demand 20 years ago, and it really was the next step. It was bringing the practice of pharmacy into clinical supplies, GMP packaging and labeling. But there were still nuances that I just struggled with, from labeling requirements to gang printing of labels to master batch records to batch records and what all that meant. And now let's go beyond On Demand. It's 20 years past that. Let's get to the next level. It's time to discuss and move to E2 dispensing. And what I say there is, yes, this is going to be problematic. Yes, we're like, oh my God, he's off in left field. But if you believe in the On Demand, wait till you really start to understand what's going on in E2 dispensing. And I'd be very happy to discuss it with you point by point and argue and be, of course, great over a glass of wine. Maybe I'll go get one now. But let's talk about it. Just like we did with On Demand. Now everybody's doing the On Demand and saving time and money. Let's go to the next level and really save time, money, and improve quality. Thank you very much, and I look forward to the next session that I will present next Thursday. And I think that's on, even better, counseling requirements. We're going to love that. You're going to love it. Thank you very much. Have a good day.